There are a number of factors, I think, that are leading to a very grim statistic.
Yeah.
Just released by the CDC. For the first time in our country's history, 100,000 Americans have died of drug overdoses in just 1 year.
So it is up almost 30% from the 78,000 deaths the year before. Joining us this morning from the Scottsdale Recovery Center is Clinical Director Chrissy Orellana. Chrissy, good morning to you, and thank you for your time. Can you give us some perspective on what is happening right now? Does it at all have to do with people spending a lot of time at home and maybe isolated a little bit more than usual, at least in the past year and a half or so?
Absolutely. Isolation, a lack of accountability, not having that schedule that people have been used to and actually function really well with is definitely contributing to, I believe, the rise in overdoses and substance use.
Well, and the one drug I keep hearing getting mentioned over and over and over again, and unfortunately it's coming across our border in large quantities, is that fentanyl, right? It's a synthetic opioid. We were sitting down and we had a young member of our staff, and she was saying that actually, and she knows some recreational drug users, that fentanyl now is finding its way into all sorts of different recreational drugs, and just a little bit can be deadly.
Absolutely. Many different drugs are cut with fentanyl, and no one knows it before they use it, and accidental overdoses are occurring more often.
What type, if you can give us kind of a visual of the type of person that would be affected? I think sometimes when we think of people using drugs or overdosing, we think of somebody who is heavy into this stuff. But are you seeing people who are professionals? You know, what type of industries? It affects everyone in every walk of life, right?
Absolutely. I think that it's really important to break through the stigma of what drug addiction, alcoholism really looks like. It can affect anyone and everyone. There is no face of this. This could be anyone.
So, I mean, and now we're looking at it from, say, a parent's perspective. So what are some of the things that, if you're a parent and you've got, say, a teenager or a young teen or maybe even an older teen, things that are pretty obvious signs that you can look for and say, hey, you know, because obviously there's all kinds of teenage angst going on, but what are some of the things you can look for that are fairly obvious signs of drug use?
Lack of interest in things that were previously something that the person enjoyed, a different crowd that they might be hanging out with, mood changes, having any extreme reactions to situations that are more so unprovoked. Really just kind of looking at how the individual is interacting with people around them, I think, is a very telling sign.
And you have on this list of items neglecting personal hygiene and pinpoint pupils. Is that a telltale sign when you take a look at someone's eyes that could be the case? In fact, if you see all these other things taking place at the same time?
It can be, absolutely.
So if you suspect maybe that your child or a loved one, husband, wife, who knows, grandfather, is going through this, what's the best step to take?
Talk to the person. I think that it's really important to have open communication, to share concern, to intervene early, and then there are many resources to get help.
Chrissy, thank you so much. If anyone out there has any questions, do you have a phone number or a website they might be able to seek out for some information or resources?
Absolutely. If they just look at scottsdalerecovery.com, they'll be able to find us.
All right, Chrissy, thank you for your time this morning.